Hello students, my name is Dr. Icha Dayaramani. I am serving as principal in Silver Oak Institute of Pharmacy and Research, Ahmedabad. Today we will discuss the most important topic for any pharmacist, that is rational drug use. The outline of the session, the topics that will be covered in this podcast. We will discuss the definitions, what we mean by rational use of medicines, what is the reason or rationale behind the rational use of medicine, why we should use medicines rationally, what are the various reasons for the irrational use of drugs and medicines, what are the dangers of irrational drug use, what should be the strategies to promote rational use of drugs, and then we will conclude the session. Now, coming to the definition, as per World Health Organization WHO, the rational use of drugs requires that patients receive medications appropriate to their clinical needs in doses that meet their own individual requirements for an adequate period of time and at the lowest cost to them and their community. So, this is the official definition of rational use of drugs given by the World Health Organization. Here, the most important keywords is that the patients must receive the medicines which are suitable or required to satisfy their clinical needs. So, for the symptoms or for the disease or disorder that the patients are want the medicines, they should get those medicines only. They should not get additional medicines, nor they should get less medicines. So, they should be appropriate to their clinical needs in the required doses, means in the correct doses for the individual requirements, because each individual is different in terms of physiology and body, and the dose may therefore differ according to the body mass index and body weight of the patients. So their own individual requirements of the doses will define the rational needs also. Thirdly, for an adequate period of time. So we know that we are not going to take the drugs and medicines for long durations of the time and for our lifetime. So for the adequate period of time as it is required, they should be able to receive these medications even for a day, even half a day, for some hour, or maybe for longer period of time, and at the same time at the lowest cost to them and their community. So these are the four aspects that will encompass the rational use of drugs, which is officially defined by the WHO. Now let us see what are the criteria for using the medicines. Why we need medicines? Because medicines and food are different. Food we need for energy and to maintain and carry out our life processes. But medicines is a corrective mechanism that we use chemicals in order to rectify certain problems or inconvenience that we face with our body and mind. So the criteria for using the medicines is appropriate indication. So whenever we face any discomfort or any inconvenience in the body, we visit the doctor or the physician and we tell them our symptoms. The doctors and physicians will diagnose the problem, maybe with the help of certain tests or examinations, and they will diagnose the disease or the disorder for our suffering. Then they would prescribe appropriate drugs that will help in curing or mitigating the inconvenience or the complaint. So appropriate drug considering efficacy, safety and suitability of the patient. The third criteria for using the medicines is affordability. So medicines, since it is in the view of humanity for the alleviation of human suffering, it should not be heavily priced, and at the same time the business of the medicine should also not suffer. It should be feasible and viable, but at the same time it should be affordable. So affordability of medicines is an important criteria. The next criteria is appropriate administration, dosage and duration. Now it is up to the patients and their relatives and caregivers to administer the medicines properly as per the labeling conditions or as per the package insert or the instructions that are provided by the doctor or the pharmacist or the nurse. So appropriately they need to be administered for the best effect. In the dosage, suppose 3 times a day, 4 times a day, twice a day, at morning, at night, before food, after food. So these are the dosage instructions. And for the duration, so suppose the medicines are prescribed for 5 days, then the patient must continue the medicines for 5 days. They should not discontinue, they should not miss the dose at their own will. Willfully they should not do it. There should not be any contraindication. So many times people are taking some medicines, they have some previous medical history, so they must be having some certain allergies or certain some food habits. So these all must be communicated with the physician or the pharmacist, and the drugs that will be prescribed to the patient, so that they do not cause any serious side effects or any contraindications. Appropriate patient adherence to the treatment. It is the duty of the patient for the to get the maximum benefit out of the entire therapy, that the patient adheres to the entire medical treatment in terms of administration of the medicines for the particular dosage that are prescribed, and for the entire duration of the therapy that is prescribed by the physician or the doctor. Appropriate patient information must be given by the manufacturers and by the physicians and pharmacists. They should be communicated in the vernacular language, easy to understand, or maybe through the pictures in case of certain patients. So, appropriate patient information, what is to be eaten, what should be taken along with the medicine, what should not be taken along with the medicines, any dietary changes that the patient needs to make, certain things to avoid, like that. So all these are the criteria for using the medicines. Now, next point that we will discuss is the factors that influence the use of medicines. So we say that treatment choices are available because the patients are going to the doctor. So it is the choice of the patient to select the doctor, to select the hospital, to select the dispensary. So what are the factors that influence the use of medicines? We know that for a person, for a particular indication or a symptom, there are 10 types of therapy or 10 types of medicines or compounds are available. So a doctor may prescribe any one out of the 10. So what are the factors that are influencing the use of medicines? So there are categorically 5 factors: intrinsic factors, societal factors, work group factors, workplace factors, and information that is available to all the stakeholders for the therapy. So these govern largely the treatment choices. So let us discuss one by one, which is the intrinsic factors. Example is the prior knowledge and the habits. So use of medicines will be governed by the prior knowledge. So if a patient is having certain prior knowledge that yes, these this medicine should be, like say for example iron, so iron must be taken. If it is taken with citrus fruit juice, then the absorption of iron will be better. So if the patient is having such prior knowledge, or antacid, it should be taken early in the morning before having anything. So this is the prior knowledge that the patient is having, so it will definitely influence the use of medicines. If there is a Disprin, that is a dispersible tablet, it has to be taken prior to taking the tablet. It has to be dissolved in a glass full of water, allow it to settle, allow the bubbles to cease, and then the patient will consume the solution. So this is all the intrinsic factor which depends on the prior knowledge of the patient, or maybe ignorance of the patient. So if the patient is ignorant, if they don't know um, what is to be done with the dose of the drug, and what are the certain mental inhibitions the patient is having, so definitely it is going to influence the use of medicines. Then there are certain habits. So if the doctor has, say for example, discouraged the use of alcohol along with certain antihistaminic drugs, and but the patient is having the habit of having alcohol, then he may not pay attention, and this will influence the use of medicines. Sometimes certain medicines are taken by the patient in the form of a habit forming way. So patients are having this habit of taking these analgesic and anti-inflammatory drugs on routine basis. So patients are taking without giving a thought about the root cause of the complaint, but they will be taking it. So these are the examples of intrinsic factors, so which are dependent truly on the patient, and not much can be done to address this problem, because it is related to the intrinsic character of the patient itself. Then there are the societal factors like social and cultural factors, and economic and legal factors. So they also influence the use of medicines. So there are certain legal factors. So certain drugs are banned. Then there are certain, so that definitely the use of that medicine would not happen. And if the drug is banned due to some legal action or legal problem, so the patients who are consuming that drug, or they are prescribed with that particular compound, it will not be available, and therefore they will go to the doctor and seek for another substitute compound. So this is the legal and economic factor example. Another one is the social and cultural factors. So there are certain beliefs that are providing prevailing in the society, that one should not visit the hospital, one should not get admitted into the hospital. The bed sheets and things, like patients are coming in the hospital, then there is a risk of cross infection and things like that. Then there are certain cultural factors. So people are taking multi therapy, they are visiting the allopathic doctor, but at the same time they would be visiting some drug and magic remedy sort of person. So that is the cultural belief. And these people, they will be, ethnic way, they will be promoting certain drugs like the steroids, or maybe benzodiazepines or morphine. So such natural substances they would be promoting, and that would also influence the use of medicines. The third category of factor is work group factors, that is the relationship with the peers and authority and supervision. So definitely when it comes to the corporate sector, so pharma is also a corporate sector largely. It is a very structured market of medicines, mostly all over the world. And therefore the use of medicines would be influenced with the relationship with our peer group or community. And there would be talks, and there will be suggestions that, oh, my cousin took this medicine and this happened and things like that. So the person who is listening will also get influenced, and things like that. So these are the examples of the work group examples. And then there is the category of workplace, that is workload and staffing and infrastructure, again related to the distribution channel and the manufacturing sector, and maybe of the doctors also. They might not have the certain licenses to sell the drug. There would be some problem with the workloading and staffing. So appropriate staff is not available for, say for example, to give the IV injection. So we need a trained medical staff or nurse. And in case of inavailability of the nurse, the doctor may consider prescribing a oral dosage form instead of the IV dosage form. So such type of factors may also, affect the use of medicines. And the fifth one is the information that is floating in the market and the community in the social media groups regarding the scientific information. We know that today Google is the most, widely used source of information by each and everybody to check and verify what happens, what are the side effects, what are the indications, what are the contraindications, what is the name of the compound, things like that, what is the price. So scientific information is also available in the public domain, and they greatly influence the use of medicines. At the same time, the influence of the drug industry as a whole also is a major factor that influence the use of medicine. So these are the five categories of factors that influence the use of medicines all over the globe. Now let us discuss the factors that raised the issue of rational drug use. So why suddenly there is we are talking around the globe, across the globe, about the issue of rational drug use. So why? Because the prime reason is the explosion of drugs. That means the use of drugs is uncontrolled, and um, many drugs are being used for a single indication. So even in a prescription, or where the prescription should may contain two drugs, but still the prescription would be containing like minimum 7 to 8 drugs that are prescribed to the patient. That is because of the drug explosion. The second factor is efforts to prevent the development of resistance. Due to uncontrolled use of antibiotics, we know that microorganisms have become resistant to many antibiotics, and that is why that is why the efforts are being made all over the globe to prevent the development of resistance against the common pathogens. Growing awareness is also one of the concerns, one of the reasons why there is a global talk regarding rational drug use. Then the overall cost of treatment has increased many folds, and this has also led to this discussion. And lastly, increasing awareness and increased implementation, effective implementation of the Consumer Protection Act has also stirred this issue, and the talk is there about the lot of people are talking about the issue of rational use of drugs. Now let us see what are the reasons for irrational use of drugs. So there's a lack of information. The role models are the teachers or the seniors. Uh, what they have done, so people are following that. And then there is a lack of diagnostic facilities, uncertainty of the diagnosis. So there is a medicine for all possible causes rather than the root cause. So many times we see there is a demand from the patient to prescribe more drugs. So if a doctor is not prescribing any drug, the patient may consider that the doctor is not appropriate and he's not knowledgeable, and that is why they may stop visiting that particular doctor. Then increased patient load is also one of the contributing factors towards the irrational use of drugs. The sixth reason for irrational use of drugs is the promotional activities by the pharmaceutical companies. So everybody wants to promote their drugs and to increase the profits and to sell the drugs as products or consumer items, and that is why there's an overprescription of drugs that we have witnessed in the past few decades. The drug promotion and exaggerated claim by the companies is also one of the major concerns. And then lastly, the defective drug supply system and ineffective drug regulations contribute majorly towards the irrational use of drugs by human beings. Absolutely irrational use is comprised of largely the injudicious use of antimicrobials. So even we see that antibiotics are being prescribed in cases of viral fever and diarrhea, where it is not because of the microbial infection or infestation, but it is due to the viral infestation. So antibiotics, we know that will not be very appropriate to be used in such cases. Then unnecessary combination of drugs. There are a lot of fixed dose combinations that are available in the market, and they contribute to the absolute irrational use. There are use of drugs not related to the diagnosis. So doctors are just prescribing the drugs which are not related to the actual diagnosis. Incorrect route of administration is also irrational. Incorrect dosing, underdosing or overdosing is also one of the important factors of irrational use of drugs. Incorrect duration, so either the duration of the dosage form to be administered, either it is very short or either it is very long. Unnecessary use of expensive medicines is also one of the irrational use. So where we can the patient can be cured by using the simple medicines. So even they are provided prescription containing lot of expensive medicines. Unsafe use of corticosteroids is also one of the important irrational use of drugs. And polypharmacy is also one of the important cause of irrational use of drugs. So polypharmacy means a person is taking consulting an allopathic physician. At the same time, after 2 3 days they will visit another physician. After 2 3 days they will visit the ayurvedic physician and things like that. So they will combine all sorts of drugs and chemicals, and this would also contribute to the irrational use of drugs and medicines. The hazards of irrational use, we know that it is directly affects the treatment and the therapy and the outcome of the patient. So ineffective and unsafe treatment overall, the over treatment for the mild illness and maybe inadequate treatment towards the serious illness, both are the results of hazards of irrational use. Then there is exacerbation or prolongation of illness that is many times witnessed because the treatment is not appropriate, the treatment is not proper. Distress and harm to the patient is the key result of the irrational use of drugs, because ultimately patients are going to suffer. Then there is the increased cost of treatment. The treatment cost increases manifolds. And there is increased drug resistance and misuse of infective drugs when there is an antimicrobial drugs over prescription. Increased adverse drug events, whenever the use of drugs is uncontrolled, or definitely that it may rise to adverse drug events. Increased morbidity and mortality is also one of the hazards of irrational use of drugs. Now, steps of rational use. Now, we know that these are the problems that are prevailing in the communities, but how to introduce a rational use of drug, and how to create an awareness in the minds of the people regarding the rational drug use. So step one is to identify the patient's problem based on symptoms and recognize the need for action. So just identify the problem, not based on the mental inhibition, not based on the saying of the patient, but based on the symptoms, and then thereby define the need for the required action. The correct diagnosis of the disease and definition of the diagnosis is very important, should be recorded in the written form so that it is available in a transparent manner. Then list possible interventions or treatment. So what are the possibilities of treatment, what should be the probable all the possible interventions. So whether a drug is required to be given, or it is okay if we do not give a drug and just prescribe some lifestyle modification, or maybe some exercise or some food modifications, alterations, etc. And then if yes, there is a requirement of the drug that is cited, then we need to identify the drug as a generic way. The step 4 is start the treatment by writing an accurate and complete prescription with name of drugs, dosage form, dosage schedule, total duration of drug treatment, etc. The step 5 involves proper information, instruction, and warning that is to be communicated to the patient, and slight awareness regarding the possible side effects, the drug dosage schedule, the dangers or the risk of stopping the treatment suddenly. So all these things must be communicated to the patient so that he adheres to the prescription and irrational drug use can be stopped. Monitor the treatment to check if the particular treatment has solved the patient's problem. So there may be two types of monitoring. One is the passive monitoring, second is the active monitoring. So passive monitoring is done by the patient himself. When the patient has acquired the understanding of what to do if the treatment is not effective, or if there are too many side effects that are occurring, so what is the course of action that the patient has to follow. And active monitoring is done by the physician or the healthcare provider, and they need to take an appointment and check the response of the treatment. So passive monitoring and active monitoring are the two types of monitoring the entire therapy. Now, what are the strategies to promote the rational drug use? So there can be fourfold strategic plan comprising of educational strategies, managerial strategies, economic strategies, and regulatory strategies. Now, educational strategies we will include the training for the healthcare providers, including doctors, pharmacists, nurses, all the distribution channel, and all the people and sectors involved in the entire course of action of drug manufacturing to drug prescribing and administration. Printed materials may also contain the literature and awareness, news, the formularies or the therapeutic manuals and persuasive print materials all can be listed, and they will serve as educational material to all the people who are involved. Then there can be media based approaches like AV, audiovisual tapes, radio, television, posters, etc. So these all comprise of the educational strategies. Now coming to the managerial strategies, there can be changes in selection, procurement, distribution to ensure availability of essential drugs at least to all the patients all over the globe. Strategies aimed at the prescriber, so prescribers or the physicians who are prescribing the drugs must be educated regarding the rational use of drugs and what can be their contribution, and how they can be helpful in introducing and proliferating the rational drug use amongst all. And then there can be dispensing strategies, so course of treatment, packaging, labeling, generic distribution, all this information must be supplied to the patients. Fourth is the economic strategies, that is to avoid perverse financial incentives. So many pharma companies are causing obligations to the physicians and pharmacists and stuff like that. So all these type of financial incentives and financial obligations must be discouraged, and prescriber salaries must be done from the drug sales. Insurance policies that reimburse non-essential drug and incorrect doses, and flat prescription fees that encourage polypharmacy by charging. So these are all the examples of perverse or inappropriate financial incentives. Next is to restrict or to limit decisions. So drug registration has to be ensured that the drug that a physician is prescribing, the dosage form is registered with the FDA. Banning the unsafe drugs, regulating the use of different drugs to different levels of health sectors, and regulating the pharmaceutical professional activities only work if regulations are enforced. So all the points can be the regulatory efforts to discourage irrational use of drugs. Now, as per WHO, they have introduced 12 key interventions to ensure rational use of drug. That is, first is to establish a multidisciplinary national body to coordinate policies on medicinal use. Second is the use of clinical guidelines and development and use of EML, establishment of drug and therapeutics committee in district hospitals, inclusion of problem based pharmacotherapy training in undergraduate curricula. So a lot of case studies must be there to solve by the young pharmacist, educating themselves, continuing in service medical education as a licensure requirement, supervision, audit, and feedback, use of independent information on medicines, public education about medicines, avoidance of perverse financial incentives, use of appropriate and enforced regulation, and lastly, sufficient government expenditure to ensure availability of medicines and staff. So, all these are the 12 key interventions as provided by the WHO. So, concluding the discussion, we come to a conclusion that drug use is usually the end of therapeutic consultation. Ensuring that the correct drug is given to the correct patient is a high priority for all health professionals. Secondly, we all have a duty and responsibility to the public to ensure that right drug is prescribed, dispensed, and taken. Medicines, although public good, are not ordinary articles of commerce, must be realized by each and every individual which is involved in a any therapy or any process. Improving drug use improves the quality of care and frequently lowers the cost of the drug. So these are the conclusions, not limited. Irrational use of medicines is a very serious global public health problem, and therefore all the efforts are required from all the sectors and all the healthcare provider team members to ensure that only the rational drug use is promoted, and it can be improved only if a fraction of resources spent on medicines was spent on improving the use of the drugs. So these are the references that I have done while preparing my uh, slides. So thank you all of you for a patient listening.